So why have you not heard about this? Well, clomiphene citrate is a generic medication. So there is no marketing of this medication, and it tends to be extremely inexpensive. Now, there are companies coming out that are trying to get this clomiphene at the optimal dose where it's approved by the FDA. And that's going to happen in the next year or two. And I can't wait to see those medications because it's going to be a change. Rather than taking, an outside source of testosterone, make it yourself. And that's why people haven't heard about this. But I am a fertility doctor, and I know that these testosterone products that you hear about decreases sperm counts and shrinks the testicle, and that's the opposite of what I'm going for. So in general, you don't want anything that's going to adversely affect your body. So if you take these medications, and in the future we'll have FDA-approved medications that'll have less side effects than taking testosterone, from an outside source. And what are those side effects? Well, some of the side effects of the testosterone shots is, again, a lower sperm count, the shrinking of the testicles. Gels can actually, you could actually give your partner testosterone. If you're holding a baby, it could contaminate the other person. One of the problems that I see with shots is that you want a physiological dose of testosterone, because if your testosterone is from here to here, you want it in the midline. So if this is low normal and this is high normal, testosterone shots tend to boost. When you take that shot, your testosterone is above normal. And then after about between about 10 and 14 days, it goes back down. You take another shot, it gets above normal. Well, what happens when the testosterone is above normal? You make more red blood cells. Men who are anemic, that means they don't have a lot of red blood cells, many of them have low testosterone, and the treatment is testosterone. Well, but if you have a perfectly normal blood count and you're given these testosterone shots, you tend to make too many red blood cells. You're at a higher risk of having a heart attack or a stroke. So it's very important. If you take these medications, you have to have a doctor following you to make sure that red blood cell count doesn't go up. Now that's with testosterone. Why take those? Sleep more, eat better, lose weight, and if you need help, get a medication that'll allow your body to make its own testosterone.